And you came back and you said, listen, I just learned some really new techniques and some new innovations and would love to hear them.
Yeah, so we can back up for a second.
Sure.
Part of the thing that made me want to talk about innovations in eye care was partly the phenomenon that you get sometimes in Fayetteville. You've probably noticed this when you have other people that come and talk politics or whatever they're talking about. And that is, some folks have the sort of poor stepchild mentality that if we do something here in Fayetteville, well, if you go to Raleigh or you go to Atlanta or you go some other place, maybe they do it better.
Mm-hmm.
But the truth is, and I was thinking about this as I was out in Vegas for the meeting, not really my favorite town, but where the meeting happened to be. And I was looking at a bunch of equipment, and we were looking at some very cutting edge stuff. How many of the national distributors talked about when we reviewed the things that we had? They said, well, goodness gracious, almost nobody does all that. Almost nobody has all that. So I thought it would be fun, especially for folks who are prone to perhaps leave the county to get health care. And I think that sometimes they do that because of that perception. You know, they haul mom an hour and a half away to get something done. And so let me encapsulate as a concept where we are, for instance, with just cataract surgery in our group. So there's about 3 million cataract surgeries a year. So if you look at the data from, say, last year, about 5% or less of those was actually laser-assisted cataract surgery, something your listeners may be hearing about, right? Okay. So we have 2 of those lasers. So we're able to do any day what roughly less than 5% of the surgeries, or 5% or less right now, are doing in the United States. Now that number is growing because it's new technology. But still, in this country, most ophthalmologists don't do laser-assisted cataract surgery. Well, then beyond that, we have something called an intraoperative aberrometer. I'm not going to explain what it is, but basically what it does is help us select, when the patient's laying on the table, what the implant power is. Then beyond that, what we also have is what's called a digital marker. So in the clinic, if you came in, we would actually measure your eye. It would do a digital overlay of your eye. We'd download it to a thumb drive. Then when you go to the OR, we'll plug that into our lasers or our operating microscope or other adjunctive equipment, and it'll superimpose onto your eye a template of where we're going to make incisions and do these different things. So if you look at it like Venn diagrams, remember where they had the big circle and the circle inside the circle? So, okay, so 5% or less is going to be the number of laser-assisted cataract surgeries in the country. If you look at how many of those also have aberrometry, there's only about 400 or less centers in the whole country that have aberrometry, or even there are approximately, say, 400 instruments. Well, we have 5 or 6 right here in Fayetteville. So if you look at just sheer numbers, there are very few centers, relatively speaking, in the country that have that technology. Then when you go to these digital markers, virtually no one has that. In fact, until a few months ago, we were the only practice in the state that had all that technology to apply to cataract surgery. That included Duke, that included Chapel Hill. And so the point of the story is that you don't have to leave town. And what I was actually...
But there is that mentality.
It's crazy. But and you know me, Goldie, I don't need anything new to do. So this isn't really, the concept isn't to promote what we do as much as it is to say it's just crazy to take the extra time and the investment of energy to go out of town to do certain kinds of things. For instance, we are now in the process of acquiring some equipment as a byproduct of this meeting that will help in the medical assessment of macular degeneration and glaucoma. And these are really cutting edge devices. And when you add this to the armamentarium that we have, there will literally be no new thing that you can do in the medical diagnostic assessment of glaucoma and macular degeneration than what we have right here in town. In addition to that, of course, as you may know, we bring in Duke Retina Service, and so it's hard to top that in terms of diagnostic and surgical acumen as well.
Why do you think that is, that people think bigger city, better care? Where did that start?
So to be honest, it's because of one of my pet peeves in medicine. I don't like billboards. Corey knows this because she does our community service stuff, and part of the things that she asks me to do sometimes is sort of marketing stuff. if I had my way, I'd just show up and work every day
Right.
and tell people what we're doing. And I wouldn't, we wouldn't have an ad or a billboard and stuff like that. That's sort of old school. It's not the way they do anymore. But in bigger cities, there's lots of competition. So there's lots of advertising. And so you see these crazy ideas that people are out there advertising guaranteed 2020 vision.
Right.
And it's crazy stuff. So I think that's where some of it comes from.
Interesting. So you think it's in the marketing?
Well, I mean, I think so many things are marketing driven these days that medicine is certainly. I mean, when we were growing up, did you see erectile dysfunction ads on television?
Of course not.
Of course. So the point is that marketing drives so many things now, including medicine.
Interesting, Jim.
Well, I recently had back surgery, and I went to more regional,
Right.
and it wasn't because I had heard anything bad about Cape Fear Valley. It was just that there was a particular doctor that had been recommended to me by a number of people,
Sure.
and he used to be here, and he's over there now. So that's where I went. But
Mhm.
we always have that mentality of the expert from afar. We even do that here in our local politics. I mean, what do? We always get a consultant from Idaho or
Right.
someplace, and pay a boatload of money when there are probably people right here in the local market that could do the same thing.
Yeah, I think it's funny, and I do think this is specialty specific because one of the tough things, and part of so to his point, and I think he brought up an important point. One of the things that happens in a town like Fayetteville, and we've talked about this before, in the way we think about how we grow the city and the way we think about how we do these things that bond programs and so on should support. If you want to attract good cutting edge doctors, one of the things you got to do for millennials is actually help create a city that they want to come to Jim's point. But I think that sometimes it's specialty specific because we can attract certain kinds of talent. It's just that it's not true in ophthalmology. So I do think it can be specialty specific. Insofar as this consultant, there's a funny thing in medicine. They say you do one case, you've done your first case. You do your second case, you've done more than one case. You do 3 cases, you're a consultant. And sometimes I think that's true in politics as well.
So let me ask you a dumb question. You mentioned now LASIK assisted cataract surgery. Before LASIK, were you just cutting?
Well, so it's not LASIK assisted cataract
Laser
surgery.
assisted. I'm sorry, laser assisted.
Well, but I'm glad you said it that way because there's so many misconceptions because frankly we just got a bunch of lasers, right? And they all do different things. But the interesting thing about the laser we're using now is it's a femtosecond laser, and what happens is it allows us to program digitally cuts. So it doesn't do the cataract surgery. It allows it to be more precise. And because it does some cutting without putting any downward or internal force on the eye, it's done with light rays. You can argue that every one of those cases you do that way, it's gentler on the eye. So that's why that kind of technology has garnered so much interest. It allows the incisions to be a bit more precise. You can digitally, if you marry it up with what we have in our clinic, which is what makes it so exciting, you can literally map it out on a computer in the office, program the laser in the operating room to do the cuts exactly where you want them.
So 5 years, 10 years down the road, will all cataract surgery be laser assisted?
It'll be laser assisted in some way, and there'll be some other technology. I mean, what's happening in ophthalmology right now is pretty exciting. And I think that if you take the long view, things like nanotechnology and some other things are going to be employed in ophthalmology because we need teeny tiny stuff, right? And what's going to be fun is when we can use, and it'll be, your grandkids or something, but when we can do nanotechnology and program teeny tiny stuff in the eye to make it work better, that'll be really fun.
Dr. Wayne Riggins with us from Cape Fear Eye. You touched on something that I'm glad you touched on it because I want to talk to you a little bit about it. You were on the UDO task force. You were on the Arts Council board. You have been involved with the Festival Park task force. You are no stranger to local politics and boards and getting things done here. One of the things I've heard from a number of people is because we lack amenities here in Fayetteville, it is tough to attract doctors and even dentists. Because I was talking to Ginny Jones over at Village Family Dental a couple of weeks ago. They're having trouble getting dentists. And it's not the dentists that have the problem with Fayetteville. It's the wives. It's the families. Because when they look, they don't see parks and pools and skateboard parks and things that attract people to a city like ours. Talk a little about attracting doctors. Are you having trouble finding doctors at Cape Fear Eye? Have you run into this situation before?
Sure, yeah. It's a big concern of mine, and probably part of the reason that I was engaged in some of those other things is I still remember the very first time I drove into Fayetteville. Truthfully, this was 1993, and drove through downtown, and at that point in time, 80%, 85% when we did the first survey of downtown inventory was boarded up. Now, people who live here now and didn't go through downtown then, or didn't pay attention, because a lot of people wouldn't go there, didn't know that. So I thought, great bones, what a catastrophe. And so then I thought about how we game change, and that's when I started doing sort of the geeky thing that people like me do. Start reading things about gentrification and urban renewal and so on, and figure out how you make policies. So I don't, run for office and stuff like that. So what I do is I put my nose to the grindstone and work behind the scenes to try to rewrite the rules so that the way we do things are smarter. How does that interface with getting professionals and what we have classically called white collar industry here and so on? Well, if you look at surveys of millennials, curious thing, most millennials of what they would call professional or educated class want to live within 5 miles of a happening metropolitan area. Now, mind you, it doesn't have to be Manhattan. It could be a university town, it could be a town of relatively small size, but what they're looking for is simple things like parks and rec and outdoor dining and some sort of an arts complex. They're looking for things like that. And one of the things I get frustrated by is that it seems sometimes that we don't throw the long ball. We don't have the courage of our convictions to say, well, we're either going to continue to have a second or third tier vision and get exactly what we're willing to pay for, or we're going to try to at least get a 2++ tier vision and throw the long ball. Until we get the political will and actually the knowledge to do that, then I don't know that we're going to change as much as we want. I think we're going to have a deficit in all those areas.
I'm sure you've been reading the paper. I know you keep up with the Parks and Rec bond and the referendum and what they want to do. It's a $35 million package, and they're talking about senior centers and aquatic center and another pool. And is that enough at this point? The Cape Fear River project? I mean, is that enough right now?
Well,
or do we need a performing arts center and a baseball stadium downtown and those kind of things?
well, what we need is first of all, what we need to be smart. As you know, there was some question about whether or not we knew the maintenance costs of the aquarium.
Right.
Well, I believe that what we owe every taxpayer is the commitment that we're going to do smart business, not just any business. And so I think in this particular case, yeah, we need parks and rec, and we need some kind of downtown arts. Heck, you know what we need? We need a downtown hotel. Can you think of any, if you think about what we have going on downtown right now, Goldie, every doctor we bring in would prefer to stay downtown. Every architect you bring in would prefer to walk down the street, sit outside, have a meal, a beer, and go to a movie. But what we have to do in Fayetteville right now is we send them out towards Skybo or someplace because we need to put them in a decent hotel. Right? So I think, first of all, we need to encourage smart public-private partnerships, number one. Number two, in Parks Complex, and this is an idea behind the scenes that I've been proposing for a long time. In fact, I talked to some people I won't name recently this year. We have a series of small-ish parks, Festival Park, Martin Luther King Park, Rowan Park, Linear Park, that aren't currently connected. And so one of the things that you have in urban areas that I think is interesting, in areas that market and do it well, they'll connect their parks with bike trails or something, and they'll say, well, you can start in Rowan Park and you can ride a bike to Methodist University. Well, if you study a map of Fayetteville, the connectors aren't very big. If you had that vision and you worked on it for 10 years, literally there are some cases where you could probably sell a little bit of the public land to a developer if it's if it's in a suburban area, sort of like I live over in Haymount. So you could actually sacrifice a little bit of green space to generate enough revenue that then you could buy some more green space and connect the dots, because large parks without amenities often just sit. Kids don't, I was born in 1955. Kids don't run around outside in big parks anymore. So what we found in current studies of park space is if you perforate that space with a little bit of housing, A, it gets used better, B, you can leverage the income from that sale to do some other things so that you can connect the dots. I'm shocked, frankly, sometimes that we have these large proposals that get to the table where we don't have some of the simple stuff like that, because here's what I would like to do. I'd like to bring a young doctor in and take him by Rowan Park, and you say, you see that, you can take a bike ride from there to Methodist University, and let's guess it's a 16-mile ride, and a ride back. That's a day, because you get to go through botanical gardens.
Right.
And so Harry Shaw, who you gotta love for his energy, had the vision on Linear Park, but he was like the train that wouldn't stop. What we really need on council is somebody that would be the train that wouldn't stop. We need the vision.
Great points, all of them. You sure you don't want to run for office? Yeah, I know. You're a busy guy. Hey, we're out of time, but it's always good seeing you. Welcome home from Vegas and the big convention there. Some
Appreciate
great information on cataract surgery, and
Sure.
I know LASIK. There are innovations almost every year in LASIK surgery,
Yep.
and people who don't have 20/20 vision. There are so many options for them now.
That's
So many more than there were even 5-10 years ago.
Right. And the bright spot of your day is that I didn't sing happy birthday to you.
We'll wait till we turn. You can do the Marilyn Monroe version when I take off the microphone. Dr. Wayne Riggins from Cape Fear Eye Associates. Wayne, it's always good seeing you. I hope
Good
you
to
have a
see you.
Merry Christmas.
Thank
Happy
you.
holidays.
All right.
7:46. It is a